Hello students. Today in the subject of medical microbiology we are going to study about the disease named as hepatitis and you will gain a lot of knowledge about this very particular disease and how lethal it is in reality. So our main purpose is to make you understand the dangers that are involved when you are dealing with hepatitis and outcomes will be you will be able to understand the fundamental types, applications that are employed in the prevention and cure of this hepatitis disease. So, hepatitis is mainly linked with liver, and it is a viral disease, and how it is caused, and what are the patients, and how deadly situations they face, and how contagious it is in nature, and what are the different types that are employed there, and what are the vaccines that are available nowadays. So, in this image, you can see the international symbol that is used for hepatitis, and hepatitis is a medical condition defined by the inflammation of liver and characterized by the presence of inflammatory cells in the tissues of the organ. So, hepatitis is 200% linked with liver and disorder caused uh, in that very particular organ or tissue. Okay, so the name is from Greek language, hepa. The hepa term is being hepat, meaning liver. Okay, so in Greek, the hepa means liver, and it is means inflammation or swelling. So hepatitis somewhere combined in Greek language, which means liver inflammation. Okay, whenever you are studying these terms or these things, you must understand in depth meaning of those terms. You just not have to mug up the whole definition or terminology. The things are very simple. If you uh, dig up for their root word or meaning, then you are able to very easily understand the real meaning and the real scenario that has to be carried out in order to understand the meaning of that very particular word. Okay, the condition can be self-limiting or can progress to fibrosis or cirrhosis. So here you can see that hepatitis may occur with limited or no symptoms. Okay, sometimes the symptoms are not that much uh, what you say prominent, and sometimes they are also prominent and visible, but often leads to a jaundice and malaise. So hepatitis is acute when it lasts less than 6 months. Okay, then hepatitis is said to be of very minor condition, and chronic when it persists longer. So the more and more the hepatitis is persisting, the more and more lethal it becomes. Okay, basically it is a liver infection. Okay, all the hepatic term is always used uh, in the field of medical microbiology to elaborate all the conditions that are linked with liver. Okay, and titis is the Greek word that is used for inflammation. Anywhere titus is being mentioned, the condition is referring to you any swelling or any inflammation. Okay, a group of viruses known as hepatitis viruses cause most cases of hepatitis worldwide. Okay, all over the world, the hepatitis viruses are certainly responsible for causing such diseases. Okay, but hepatitis can also be caused by toxin substances. Okay, the substances that are very toxic in nature, the substances that are very poisonous in nature, that can also lead to hepatitis infection or inflammation. Other infectious and autoimmune diseases can also cause this inflammation or damage. Here in this image, you can see the very different stages: the chronic hepatitis, cirrhosis, hepatocellular carcinoma. Okay, well, you can say it leads to liver cancer. So difference in all the stages are shown here. And in this image, you can see the diagram of human gut and the position of liver and its all components. So liver is present in your upper abdomen on the extreme right side of your rib cage. So what is hepatitis? Hepatitis refers to an inflammatory condition of liver. As its name suggests, if we understood the name and the root word hepatitis, it is commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as secondary results of medication, drugs, toxins, and alcohol. So all these several other factors are readily responsible for creating a condition of hepatitis. Okay, although it can be of viral origin also, but it can certainly also of chemical or any other origin. So any condition that causes inflammation in liver is called hepatitis. Autoimmune hepatitis is a disease that occurs when your body makes antibodies against your own liver tissue, which means your immune system is not at all able to recognize liver as its own, and they start to attack the liver tissue. Your liver is located in the upper right area of your abdomen. It performs many critical functions that affect metabolism throughout your body, including bile production, which is essential to digestion, filtering toxins from your body, excretion of bilirubin, a product of broken down RBCs. Bile products are essential for digestion of fats. Okay, cholesterol, hormones, and drugs. Everything is filtered there. Breakdown of carbohydrates, fats, and proteins, and everything is stored in the form of glycogen inside liver. They serve as an emergency source of energy. Activation of enzymes, which are specialized proteins essential to body function. Storage of glycogen, uh, a form of sugar, minerals, and vitamins A, D, E, and K. Synthesis of blood proteins such as albumin. Synthesis of clotting factors. So, liver has many and several functions that are now very easily understood with the mutual development of medical microbiology and anatomy and physiology. So, basically, what is hepatitis and what are its types? Viral infection of liver that are classified as hepatitis include hepatitis A, B, C, D, and E. A different virus is responsible for each type of virally transmitted hepatitis. A hepatitis is always an acute short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Right? Every type of disease is different. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. So here in this image, you can see the doctors are prescribing that this condition can really be chronic. So before, in addition to provide the circumstances to this particular disease to turn chronic, you must consult the doctors and medical experts in order to receive a proper treatment on time. So the summary of the story is that any type of inflammation in liver should be regarded as hepatitis. So hepatitis A. Hepatitis A is caused by an infection with hepatitis A virus that is known as HAV. This type of hepatitis is most commonly transmitted by consuming food or water that is contaminated by feces from a person who is already infected with hepatitis A. So, especially when the proper sanitation facilities are not available and people are defecating near the water bodies, and that individual is already suffering from this hepatitis A condition, and that water is used for drinking purposes by other individuals. So there are 200% chances that all the other people will also suffer from the very same condition of hepatitis A because of hepatitis A virus. Hepatitis B. Hepatitis B is transmitted through uh, contact with infectious body fluids. This is its speciality and it makes it different from other types of hepatitis, such as blood, vaginal secretion, or semen containing the hepatitis B virus (HBV). Injection drug use, having sex with an infected partner, or sharing razors with an infected person increase your risk of getting hepatitis B. So, because of these things, one can easily conceive or get hepatitis from other person or other individual without even knowing about it. Okay, so it is a chronic disease and it kills a lot of people around the world. So here the picture explains everything in short. Let's go through it. Hepatitis A is also known as HAV, can spread due to contaminated food and water or close physical contact with the individual who is already infected. Hepatitis B is transmitted through contact with direct body fluids or sexual contact. Okay. Hepatitis C, HCV, that is the name of virus, is contracted with contaminated blood, enters the bloodstream of an uninfected person. And hepatitis D, caused by HBC virus, can only be obtained when a person already has hepatitis B. And hepatitis E, HEC, spreads through contaminated food or water and is commonly experienced by frequent travelers. So you must understand what are the dangerous conditions that are involved when you are traveling to any underdeveloped or developing nation. Okay, where proper facilities are not available for uh, hygienic water or sanitation. Now, coming on to hepatitis C. Hepatitis C comes from hepatitis C virus that is known as HCV. Hepatitis C is transmitted through direct contact with infected body fluids, typically through injection drug use. Okay, when many individuals are uh, using only one syringe and sexual contact. HCV is among the most common blood-borne viral infection in the country of United States. Okay, so a lot of people, 3.9 million Americans, they suffer from this chronic infection. Okay, now hepatitis D, also called delta hepatitis. Hepatitis D is a serious liver disease caused by hepatitis B virus, HBV. HBV virus is contracted through direct contact with infected blood. Okay, what I'm trying to tell you here and what I'm trying to make you understand here is that if you take care of your sanitation, if you take care of your drinking water, then you are very less likely to get this disease, because most of the time this disease is contracted on the basis of unhygienic practices and no proper place for sanitation. Hepatitis D is a rare form of hepatitis that only occurs in conjunction with hepatitis B infection. Okay, so hepatitis B and hepatitis D are interlinked or they are combined together. Hepatitis D virus can multiply without the presence of hepatitis B. It is very uncommon in the countries like United States. Hepatitis E. So hepatitis E is a waterborne disease caused by hepatitis E virus. So HEV virus is responsible for causing the severe condition of hepatitis E. Hepatitis E is mainly found in areas with poor sanitation. See, over and over the same scenario is being repeated. Uh, they are spread by the individuals who are already suffering from it. They are spread from one person to another person because of poor sanitation and unhygienic personal practices. So, if you repeat the two conditions, many of the individuals will not get this hepatitis infection at all. Okay, so poor sanitation and typically results from ingesting fecal matter that contaminates the water supply. If an individual is ingesting this fecal matter, then these things they do get contracted from one person to another. This disease is uncommon in countries like United States. However, cases of hepatitis B have been reported in Middle East, Asia, Central America, and Africa. So most of the time, you can also conclude that this hepatitis infection is mostly found in the countries where the development is not proper. They are developing countries or underdeveloped countries. Okay, so they mostly have this infection as a result of poor sanitation and poor hygiene practices. So you must understand it. And in order to prevent it, your personal practices of hygiene should be up to the mark, and you should also have proper sanitation facilities. Causes of non-infectious hepatitis: alcohol and other toxins. Excessive alcohol consumption can cause liver damage and inflammation. This is sometimes referred to as alcoholic hepatitis. See, basically, alcohol is not at all good for your body, because it is the basic nature of alcohol that it dehydrates your body, it consumes all the water from your body and your system, and it is readily very poisonous for your system also. So, the alcohol directly injures the cells of your liver. So, it is very dangerous for not only for your liver but also for your kidneys also. So, it is a double-edged sword. Over time, it can cause permanent damage and lead to liver failure and cirrhosis, a thickening and scarring of the liver. Other toxic cause of hepatitis include overuse or overdose of medications and exposure to poisonous substances. So it is also a condition that is found in the among the individuals who are very fond of taking medicines. Okay, they always do that. Okay, I will eat this also. I'm not feeling good. Then I will eat this tablet also, without any prescription, medical prescription, or any advice from the doctor. So they can cause hepatitis to themselves only. Such people. So autoimmune response. In some cases, the immune system mistakes the liver as a harmful object and begins to attack. This is the autoimmune response when your immune system is attacking your own organs of the body, and this condition is known as autoimmune disease. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. It's three times more common in women than in men. So, autoimmune disease is really very harmful and dangerous for the people who suffer from it. So, what are the top five ways to prevent hepatitis C? You all know that. Don't share needles, avoid contact with the blood of the infected individual, use your own grooming gear, research your tattoo parlor, and practice safe sex. Common symptoms of hepatitis. What are the common symptoms where you can individually identify that the person, he or she, is suffering from hepatitis? And what are those things that are included in it? If you have infectious form of hepatitis that are chronic, like hepatitis B and C, you may not have symptoms in the beginning. Okay, in the beginning, that very particular individual can appear to be healthy and normal and functioning properly. Symptoms may not occur until the damage affects the liver function. So, when an individual starts receiving the symptoms properly, or the condition when the symptoms they become visible, is that when directly or indirectly the things they start to inflict damage or affect the normal functionality of the liver. Signs and symptoms of acute hepatitis appear quickly, and they include following things like fatigue. The individual is always feeling tired. Okay, they don't have a lot of energy. Flu-like symptoms. They always have this flu-like symptom. They're always having cold, and the urine is dark in color. Stool is always pale in color. They always have abdominal pain. They always have loss of appetite. They don't feel hungry. Unexplained weight loss. They are losing weight without any uh, logical reason behind it. Yellow skin and eyes, which may be a sign of jaundice. So these are the things and the symptoms that they appear when your liver is not at all functioning properly, and it might be suffering from the symptoms of hepatitis. Chronic hepatitis develops slowly, so these signs and symptoms may be too subtle to notice. How hepatitis is diagnosed? Okay, what are the things that are required for the diagnosis of this disease? History and physical exam. To diagnose hepatitis, first your doctor will take your history to determine any risk factors you may have for infectious or non-infectious hepatitis. Okay, so doctor has to determine and analyze your uh, medical history also. Earlier, have you ever been suffering from such infectious? Non-infectious hepatitis has everything been okay so far. During a physical examination, your doctor may press down gently on your abdomen to see if there's pain or tenderness. So every time your doctor will press your abdomen on the upper right hand side in order to see everything is okay or not. Your doctor may also feel to see if your liver is enlarged. If your skin or eyes are yellow, your doctor will notice this during the examination. So these are the things that doctors do in order to identify the uh, conditions that are involved in hepatitis. So liver function test. What are those things and what are its main importance? Liver function tests use blood samples to determine how efficiently your liver works. Abnormal results of these tests may be the first indication that there is a problem. So when they run those pathological tests, then they get the indication that there is a problem. Especially if you don't show any signs of on physical exam of liver disease. So this is how one can easily identify there is something wrong with your liver. High liver enzyme levels may indicate that your liver is stressed, damaged, or not functioning properly. So this may indicate that your liver is under stress, or it has been damaged, or uh, is there any malfunction in the physiology of liver. So this is how the doctors they conclude the functionality test of liver, and this is how they can easily determine that your liver is functioning properly or not. Other blood tests. If your liver function tests are abnormal, your doctor will likely order the blood test to detect the source of the problem. These tests can check for viruses that cause hepatitis. They can also be used to check your antibodies that are common in conditions like autoimmune. So these pathological testing, they are there to make sure that the liver is not at all suffering from any type of inflammation or dysfunction. So now ultrasound is there. An abdominal ultrasound uses ultrasound waves to create an image of the organs within the abdomen. This test allows your doctor to take a close look at your liver and nearby organs. So it can reveal the following things: fluid in your abdomen, liver damage or any sort of enlargement, liver tumors, abnormalities of your gallbladder. Sometimes the pancreas show up an ultrasound image as well. So you can sometimes also see the pancreas working there. Okay. This can be useful test in determining the cause of your abnormal liver function. Liver biopsy. So biopsy is a process where, with the help of surgery, the doctors they take out small portion from liver and test it on the basis of pathology outside in the liver. A liver biopsy is an invasive procedure that involves your doctor taking sample of your liver tissue. Okay, every time the same thing is practiced. It can be done through your skin with a needle and does not require surgery. So they will just insert a needle and poke the liver tissue, and then they will uh, take out that needle and they will analyze the liver tissue for any abnormality. Typically, an ultrasound is used to guide your doctor when taking the biopsy sample. This test allows your doctor to determine how infection or inflammation has affected your liver. So they can correctly identify what parts of liver are suffering from inflammation or infection. It can also be used to sample any areas in your liver that appear normal. So biopsy works efficiently on all the parts of liver, and doctors can readily take out the sample from anywhere they can with the help of ultrasound. So how hepatitis is treated? What are its possible treatment? Treatment options are determined by which type of hepatitis you have, whether the infection is acute or chronic. So the treatment readily depends on hepatitis type of hepatitis that individual is having. Hepatitis A. Hepatitis A usually does not require treatment because it's a short-term illness. Bed rest may be recommended if symptoms cause a great deal of discomfort. If you experience vomiting, diarrhea, follow the doctor's order for hydration and breathing. So one must also be sure about their balanced diet and hydration procedure because most of the time, uh, majority of the people they don't drink water, and hydration is the main event that is essentially important in case of hepatitis A. The hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages 12 and 18 months. It's a series of two vaccines. Vaccination for hepatitis A is also available for adults and can be combined with hepatitis B vaccine also. Hepatitis B. Acute hepatitis B does not require specific treatment. But on the other hand, chronic hepatitis B is treated with antiviral medications. This form uh, of treatment can also be costly because it must be continued for several months or years. Treatment for chronic hepatitis B also requires regular medication evaluations and monitoring to determine if the virus is responding to the treatment. So, although they do give the treatment that is essentially required for the cure of hepatitis B, but a mutual uh, analysis in between is also necessary in order to check the progress of the treatment. Hepatitis B can be prevented with vaccination also. The series of three vaccines is typically completed over a year over the first 6 months of childhood. The vaccine is also recommended for all healthcare and medical personnel. Hepatitis C. Antiviral medications are used to treat both acute and chronic form of hepatitis. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. Okay, so all the antiviral drugs are used for the treatment of hepatitis C. They may also need further testing to determine the best form of treatment. People who develop cirrhosis, that is scarring of liver, and liver disease as a result of chronic hepatitis C may be candidates for a liver transplant. Currently, there is no vaccination for hepatitis. Hepatitis D. No antiviral medications exist for the treatment of hepatitis D in this time. According to the 2013 study, a drug called alpha interferon can be used to treat hepatitis D, but it only shows improvement in about 25 to 30% people. Hepatitis D can be prevented by getting vaccination from hepatitis B for hepatitis B, as infection with hepatitis B is necessary for the hepatitis B disease. So, hepatitis D and hepatitis B are interlinked and interconnected. Hepatitis E. Currently, no specific medical therapies are available to treat hepatitis E because the infection is often acute. It typically resolves on its own when it comes to hepatitis E. People with the type of infection is often advised to get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. See, somewhat every time the advice is the same. However, pregnant women who develop this infection require close monitoring and care. So, when it comes to treating the autoimmune hepatitis, corticosteroids like prednisone and budesonide are extremely important in early treatment of autoimmune therapy. They are effective in about 80% of the people with this condition. Drugs like Imran, a drug suppressing the immune system, is often included in the treatment. It can be used with or without the combination of steroids. Other immune suppressing drugs like Celsep, Prograf, Neoral can also be used as alternatives for the treatment. So, what are the tips to prevent hepatitis? Let's see that. Practice good hygiene is one of the key ways to avoid contracting hepatitis A and E. If you are traveling to a developing country, you should avoid the following things. And what are those things that should be avoided when you want to avoid traveling when you are traveling in the developing country? Local water, ice, raw or undercooked shellfish and oysters, raw fruit and vegetables, hepatitis B, C, and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not using someone else's toothbrush, not touching spilled food. So one must also remember 28th July is celebrated as World Hepatitis Day. So vaccines, the use of vaccine is an important key to preventing hepatitis. Vaccinations are available to prevent the development of hepatitis A and B. Experts are currently developing vaccine against hepatitis C. A vaccination for hepatitis E exists in China, but it is not found in countries like the United States. So, complications of hepatitis B. Chronic hepatitis B or C can often lead to more serious health problems because virus affect the liver. People with chronic hepatitis B and C are at risk of chronic liver disease, cirrhosis, liver cancer. When your liver stops functioning normally, liver failure can occur. Complications of liver failure include bleeding disorders, building up of fluid in your abdomen, known as ascites, increased blood pressure and total veins that enter your liver, known as portal hypertension, kidney failure, hepatic encephalopathy, which can involve fatigue, memory loss, diminished mental abilities due to building up of toxins like ammonia that affect brain functions, hepatocellular carcinoma, which is a form of liver cancer, and also death in many cases. So, people with chronic hepatitis B and C are encouraged to avoid alcohol because it can accelerate the liver disease and failure. Certain supplements and medications can also affect the liver function. If you have chronic hepatitis uh, B and C, check with your doctor before taking any new medication. So now we are coming on to the MCQs. Uh, this nucleic acid is found in hepatitis B virus. The correct answer is double stranded DNA. Hepatitis D virus is the from the family of uh, flaviviridae. This hepatitis virus is not an RNA virus. The correct answer is hepatitis B virus is not an RNA. This form of hepatitis can be caused by contaminated water or food. That is hepatitis A and hepatitis E. This is incorrect regarding to hepatitis A virus. The correct answer is it can cause hepatocellular carcinoma. Hepatitis A virus cannot cause hepatocellular carcinoma. This can cause hepatitis. And a proper functioning immune system, alcohol and medicines, viruses. The correct answer is this. All these answer is D. Most reliable detection test for hepatitis B is the polymerase chain reaction for detection of HEV-RNA. This agent represents an isolated hepatitis B virus, that is GBC. This organ is majorly affected by hepatitis, that is liver. In a sample uh, of blood, doctors look for uh, which of these elevated levels to confirm hepatitis. That is how your liver enzymes are not properly. That is the correct answer. This is from where we have collected the information that I have been giving you. Thank you for listening to me.